Dr. Darshak Sanghavi has been with us a number of times over the years. He was a practicing physician for many years, wrote a couple of really fantastic books, one called The Body of a Child, and if you're a parent or you soon to be a parent, I encourage you to get this book. It's all about health and anatomy and the development of young children. And he's just a super fantastic guy, now leading a practice area and actually a P&L at UnitedHealthcare. With that, Dr. Darshak Sanghavi. Yep. There you go.
Thanks. Hi, everybody. So what I want to talk about is how do we tell the stories of our medical miracles? What's interesting is that when we talk about progress in healthcare, those stories all follow the same script. The heroes are these swashbuckling doctors, fighting big odds and taking big risks. And the heroes are these medical miracles found in the unlikeliest of places. I remember when I was in medical school, think about the stories that we all heard about. We heard about Edward Jenner, who, working with milkmaids, found this unlikely infection, cowpox, and from that developed a vaccination for smallpox, saving millions of lives and eradicating this from the face of the earth, that disease. Or think about Alexander Fleming, who found this mold growing on these fruits, and then from that deduced that we could find penicillin, which could actually rid the world of infection. That was the dream. In fact, later, the way that was mass-produced was actually in the United States in the Midwest. Somebody found a cantaloupe in the trash, which actually possessed the mold that today now produces penicillin in the quantities that we require them today. Or we think about Christian Barnard, who in South Africa performed the world's first heart transplant. These are amazing stories, and we love to tell them, and we tell them well. But there's a dark side to sort of buying into this hero narrative and always looking for the perfect cure. It has implications for how we pay for care, how we incentivize people, because it creates a winner-take-all mentality. It's even possible that the way we tell these stories may harm more than it helps. And I know this because I myself am a victim of this kind of thinking. This is my father sitting several years ago. It's my wife next to him. When I was a medical resident in Boston, my father began complaining that he was having trouble breathing. He was diagnosed probably what they thought was reflux. So stomach acid was coming up and making it harder for him to take those breaths. But it turned out he actually had a rare lung disease called idiopathic pulmonary fibrosis, or IPF. Some of you may have heard of it, but the bottom line is that it has an inexorable progress where the airways gradually scar with time. It becomes harder and harder to breathe. And individuals with this condition become dependent on oxygen tanks. You can see in this picture, he has a nasal cannula for oxygen. And most importantly, there was no effective treatment. As a medical resident, though, my access to healthcare information was vast. I found a paper in the New England Journal of Medicine that said there is a new medicine called gamma interferon. It's been used in a few patients, and it might actually reverse the symptoms of idiopathic pulmonary fibrosis. So excited to hear this, I wrote a letter to his insurance company. I said, I'm a physician. I've read the literature. I know this drug costs $20,000 per year, which was very expensive at the time, still expensive. And incredibly, they consented to allow it to be used. I felt like a hero. I felt like Edward Jenner or Alexander Fleming. Again, placing myself at the center of this story. I was going to solve this problem. The medications arrived and my father started taking them. They're delivered as an injection. Immediately, side effects started. Raging fevers that kept him confined to bed for days at a time. Ultimately, it didn't seem to really help. His lung function deteriorated. He was hospitalized in an intensive care unit at the University of Pennsylvania a few months later. And I remember to this day the feeling of holding his hand as we decided to discontinue support and watching the monitors as his heart slowed and finally stopped. Years later, a team of researchers nationwide performed a formal clinical trial of gamma interferon, administering to patients in a randomized fashion. Keep in mind, I had done this on my own. Nobody learned from my experience. They corrected my mistake. Dozens of patients were enrolled, and ultimately that paper was published in the New England Journal of Medicine as well. And what did it show? The drug had absolutely no benefit. Not only did it have no benefit, it likely shortened people's lives. It's no longer used widely today. I have to live with that. Again, I bought into that myth of the hero. It sent me on a little bit of a quest. Was there a better way we could tell the story? One that didn't rely on us investing all of our hopes in a single savior? Wasn't there a better way we could tell the story that could actually help people? And it turned out that story was right in front of me. For years at the time, this is a picture, I volunteered at a summer camp in Baltimore, Maryland. And this is a special camp. It was for children who had had cancer. And I did it for years and years. And the counselors and I noticed something really interesting. This is one picture. You can tell we had a little costume party. Every year there was a theme. One year it was like the Wizard of Oz. One year it was like the 50s. My favorite was what was called Down and Dirty Day, which actually culminated in us going to all the local grocery stores, getting their rotten food, and playing baseball with them. But what we noticed was that year after year, more and more children were in that picture. What was going on? And it wasn't just me. It turned out that between the mid-1970s and the early 2000s, the survival rate for the most prevalent form of pediatric cancer, a condition called acute lymphoblastic leukemia, or ALL, the survival rate went from under 30% to over 80%. This is a picture of one of my campers. His name is Chad. In the mid-1990s, you can see him, and we've stayed in touch. He recently completed his own medical training at Stanford and has started his own family. Thousands of kids like Chad got the chance to grow up. The question is, how did it happen? Was there a new drug that had been discovered in the Amazon rainforest that could actually cure cancer? No. A transformational genetic discovery that completely altered practice? No. In fact, during this entire time, not a single new chemotherapeutic agent or treatment actually emerged. How on earth did this happen? People started to talk to each other. Physicians, nurses, and others banded together into an organization called the Children's Oncology Group. They decided to study the doses they were all using. They worked collectively. They looked at what is the dose of the medicine, of old school drugs like doxorubicin. They said, well, should we insert it into the IV or potentially in some cases insert it directly into the spinal cord? How should we think about when we should use bone marrow transplantation? How do we manage those side effects? Year after year, they got together. Every child in the country was enrolled into the shared learning collaborative. And look at what happened. 30% survival in 1973. And then year after year, through this collaboration, we scratched out progress. A few percent here, a few percent there, and then over decades, that led to a giant leap. This was how progress is actually made in healthcare. This is the story. Once your eyes are open to this, you actually see this everywhere. And I imagine many of you feel like, oh, better teamwork, better data sharing. What is that? How does that really help? But let me give another example. The way I like to think about healthcare broadly is it's like a game of soccer. It turns out that soccer, as some of you know, it's called a weak link sport. I think about my own life. I think about all the things that had to happen. I was born into a stable household. I was fed and clothed. I went to a school. My parents took care of me. And all those things had to be strung together in order for me to be standing before you today. Health is exactly the same. All of these things, dozens of things have to go right between the time that ball is with the goalie, has to go to the defender, be passed up in order for that goal to be scored. It's a weak link game because we have to do everything right along the way. That's exactly what we learned from cancer, and here's the other example. The leading killer in our country today is heart attacks. And yet, many of you may not be aware that in the past 15 years, we've seen a 50% decline in the rate of death from heart attack in our country. Picture a football stadium full of screaming fans. Multiply that by half a dozen. That's the number of people that live who would have died every year in our country now. How did that happen? Now, for sure, we owe a great debt to the cardiac surgeons and the acute angioplasties that save people in the throes of a life-threatening heart attack. But that only explains 10% of the improvement. And these data are all from high-quality peer-reviewed journals. So what else happened? Well, 12% of the reduction occurred because we as a society invested in anti-smoking efforts. A further over 40% from better management of high cholesterol and better job doing blood pressure management. Another 10% from home-based care to actually help individuals who have congestive heart failure, other risk factors, and other causes after that. Again, it's remarkable how all of these people had to work together to deliver that result for us. There was no single hero. And you see these stories again and again and again. 30 to 40% reduction in the death rate from diabetes over the same period of time. How? Again, not a single new drug invented. Insulin has been around forever. It's through the management of the complications. It's doing the simple feet exams. It's doing that at home. It's making sure people get their flu vaccination. In fact, another example, a 25% reduction in age-adjusted rates of dementia. Think about that. Right now, we all talk about how drugs for Alzheimer's disease are failing, and what people don't realize is in the background, we have made dramatic impact. How? Through the management of blood pressure, through risk factors, lifestyle modification, public health, all those things. There's an expression here which says that public health saved your life today, you just didn't know it. I think about the same thing we think about how we tell the stories of medical progress. And that is the dominant narrative. I've told you about a couple examples, but let me tell you about my very favorite one right now. In the state of Ohio, one of the biggest problems they're dealing with is an epidemic of newborns who are born with physical dependence on opioids. Many of you are aware the opioid epidemic is one of the leading killers of young, previously healthy people in our country now. That rate has risen dramatically. How on earth can we make that better? What's happened is truly remarkable. The neonatal and other units there voluntarily have decided to get together. Representatives get together. They share best practices. They say, well, you know what? Let's sort of work together. What is the medication dose we're using to take away those symptoms of withdrawal? How are you getting mothers into evidence-based treatment for opiate use disorder? Let's learn from each other. Let's track that progress. How often are they coming back from the hospital? Let's track that as well. And one of my favorite things they're doing is they've adapted a technique learned from Latin America called Kangaroo Care, learned from watching marsupials, where they actually take their shirts, a volunteer, a parent, will remove their shirt and the child and put them in skin-to-skin contact. This is studied in large trials, and this dramatically improves the symptoms of withdrawal among newborns. Baby steps for baby health. And what we've seen in the state of Ohio is this collective, this army of baby cuddlers, has reduced the length of stay dramatically. Not only saving millions of dollars for the healthcare system, but giving these babies a strong start to their lives. Now, that isn't to say that we don't need new therapeutics and new drugs. But too often we place way too much faith in the need to find that cure. And let me give an example of how that can happen. The leading killer from an infectious disease in the United States today is no longer HIV. What recently surpassed it is hepatitis C. Present largely in the older and younger populations. In our data, UnitedHealthcare, we've looked, only about 15% of our members have actually been screened appropriately. As a result, it's entirely possible even some members of this audience may be infected and not know it. Causes liver failure, need for liver transplantation, horrible end-stage issues. But here's the thing. Years ago, scientists actually developed a cure. There's a pill. Some of you may be aware of it, Sovaldi, Mavorite. You take it by mouth, and in 6 to 8 weeks, it'll completely eradicate and cure this. A massive improvement. And yet, in the world's most prosperous nation, most people that need that therapy are not getting it. What happened there is we invested in the hero story. We developed the cure, we found the superstar, and we never built a team around that superstar. We never created the processes. We let off the gas at exactly the wrong time. And as a result, hepatitis C continues to be just as prevalent today as it may have been a few years ago. A major missed opportunity. So as we reframe that story, this has major implications for how we move away from that hero story to this notion of small steps done in collaboration. It has important implications for how we inspire our young trainees. As a major payer, it has major implications for how we pay for and incentivize care. One example might be that rather than focusing on the processes, we might just focus on what is the outcome we like. Measure that particular outcome, whether it's cure of hepatitis C or connection with evidence-based treatments for opioid use disorder and overdose rates, and let local groups figure out the best way to do that. And in those types of structural changes, that's going to be the new era of healthcare. One of the most dramatic things I see over and over again is that we already know what to do. We should be saving many more lives than we do now. It is not a technology gap, it is an implementation gap. That is, to me, the dominant gap in healthcare today. I'm a pediatric cardiologist. I take care of children who are born with very complex congenital heart disease. Throughout my career, I've continued to see patients. I still see them today. This is a sign that's posted in the intensive care unit at the hospital where I work, where some of the state's most desperately ill children lie. You can see that right there. It says, "You are stronger than you seem, braver than you believe, and smarter than you think you are." It's a quote from, some of you may recognize it, A.A. Milne's Winnie the Pooh. It's amazing how people draw strength from that. It's only when you sort of are put in that position you realize that you already have everything you need to know. I like this because what it says is that we are stronger than we know. We are actually much smarter than we think we are. Sometimes it may take decades of working together and sharing data, as we did with the group of pediatric oncologists, to actually get to that place where we're saving all those lives. But sometimes it may just be as easy as cuddling babies together. Thank you very much.
Thanks, Doctor.